Hi, Christos. How are you?
I'm good. How are you?
Good. I'm Tim from Occupational Therapy.
Nice to meet
Nice
you.
to meet
nice
you.
firm handshake.
Oh, thank you. How are you feeling today?
Feeling pretty good.
Good?
Much better than yesterday.
Oh, that's great to hear. Great
Strong.
to hear. Have you had any other therapies today?
I just had PT.
Oh, all right.
Tough. She was tough, but
Yeah,
she
they're
was
tough,
good.
but all right. I'll try not to put you through the ringer. You know, I know how those PTs can be. But.
Appreciate that.
So, has anyone gone over your precautions related to your surgery and your condition?
Not really sure what you mean by precautions.
So precautions are just a set of guidelines which the doctor prescribes to prevent you from further injuring, in your case, your heart, and as well as your surgical site, so where the surgery happened.
Oh yeah, no one's told me anything
All right, so we'll
about
go
that.
through them quick, and then after that we're going to go through some energy conservation strategies. Sounds good, and I'll explain everything as we go.
That'll help me so I don't get tired.
Yeah, so energy conservation is, I'll go into a little bit more later, but it is something that we teach you for as occupational therapists, in which you're doing things you might normally do, such as dressing, brushing your teeth, cooking, but we're teaching you strategies so you use less energy so you're able to do more throughout your day.
Great. Okay.
Sounds good?
Yep.
All right, so your first precaution is you don't want to lift anything more than 5 pounds. So 5 pounds, I know you work in a grocery store, right? You had mentioned that to my colleague Esther yesterday.
She was a nice girl.
Yeah, she is. She's great. A gallon of milk. So you don't want to lift anything close to the weight of a gallon of milk. So anything that you might place a little bit of strain, I would just avoid it.
So I shouldn't be stocking shelves or anything?
Not, at least not now.
Okay.
We're going to try to work you up there. When you eventually, when the doctor says it's okay, then we'll get back there.
Okay.
So another thing I forgot to mention, all of these precautions are related to your left shoulder because you had the AICD implanted on the left side of your chest. So this is
Right. That makes sense.
So another precaution is you don't want to raise your arm either in front of you past shoulder length, so 90 degrees, right? Or to the side of you. So you don't want to raise your arm above your head. You don't want to exercise using that arm, and you want to have minimal weight bearing. So what that means is when you're getting up, you don't want to put any weight on that arm. You don't want to lean using that arm. Sounds good?
I have a question.
Sure.
So back to me stocking shelves because
Right.
I really hate it.
Mm-hmm.
Would I be able to lift the heavy things just using my right shoulder?
For now, I'd probably avoid that. Maybe that's a question you could ask your doctor in a few weeks after we give your heart time to recover.
Excellent. Okay.
All right. So, do you have any other questions about precautions?
Nope, that was just the one.
Good to go. All right. So the next thing I want to do with you is something called energy conservation. We talked about it a little bit before.
Mm-hmm.
So yesterday when my colleague Esther came in, she mentioned that you were experiencing a little bit of fatigue, or you were getting a little bit tired when you were doing things that normally you might have been all right before this whole condition came on, right?
Mm-hmm.
So what I want to do with you today is just teach you a few strategies, just talk about them a little bit, and apply them to things you might do throughout your day, right? So that way when you're discharged, you're able to go home and do as much as possible and maintain as much of your normal life as possible, right?
Mm-hmm.
So today I think we might just talk about a few of the strategies, and if we have time at the end, we can apply them. We might do dressing with a few things. I have a few adaptive equipment that I brought with me, but I know you had physical therapy before. So if any time throughout therapy, like you're feeling a little fatigued or tired, I don't want to push you too far. So feel free to tell me, I'm feeling tired, and I think that's it for today.
Okay.
Sounds good?
Like to be in control, yeah.
All right. So what I want to emphasize with energy conservation, there's 3 P's. And I'll give you a handout with all this in the end, so I don't expect you to memorize it. 3 P's are positioning. So positioning, that just means when you stand, you're using a lot more energy as when you're doing tasks versus when you're sitting. So typically, before this all came on, you might have got dressed standing up, right?
Mm-hmm.
So something I might recommend now is dressing sitting down. And I know you're thinking, does it make that much of a difference? In the long run, that's going to save you energy throughout the day. So you might be able to do something towards the end of the day. Like I know you mentioned to Esther that you enjoy going on walks. So you might be able to get that walk in and have the energy to walk if you do throughout these techniques throughout the day. Sounds good?
Sounds great, yeah.
All right, so the second thing is planning. So what's important with planning is that you're going to need, at least for a while, rest throughout your day. So you have to plan breaks, and you want to put, tasks, the more strenuous things. So for example, driving might be a little bit strenuous. Maybe not initially, or not even driving necessarily, but let's say if you have to do laundry and walk down to your basement. You would want to plan and prioritize them. So you're doing that task right in the morning when you have energy, or maybe if you're taking a nap in the afternoon, right after that nap, because that's when you're going to have the most energy. So you want to do the most challenging task then. That sounds good?
Mm-hmm.
So I'm thinking, if I show you the sheet, this is called an energy journal. Right?
Mm-hmm.
So the purpose of this is, and we could do this today or we could do this another session, is we want to plan out a typical day for you, right? And we're going to prioritize things that we talked about it, that you want to get done, that you need to get done. And we're going to plan them according to how much energy they might need and plan them according to your rest, like I mentioned before. Sounds good?
Mm-hmm.
All right. So first thing, can you take me through a typical day before all this started going on? What are some things you like to do? What some things that you did every day?
Sure. So, I usually wake up around 8 a.m.
Okay.
I live upstairs, so I have to go down the stairs.
Okay, so are you living in an apartment or a house?
I'm in a house.
Okay, and your bedroom's on the second floor?
Yes.
Gotcha.
So I get up, I go down the stairs, I make my wife a cup of tea.
Okay.
We have breakfast together. Usually, it depends. I usually cook, but sometimes she'll treat me.
Okay.
She'll cook.
So do you like to cook?
I love to cook, mostly because my wife is terrible at it.
You're a better cook than the wife.
Much better, yes.
What is your favorite dish to cook?
I make a mean omelet.
You're a big omelet guy?
Mm-hmm.
All right.
Yep.
I like it. So maybe if this is something, do you find that do you enjoy cooking breakfast or dinner more? Do you cook dinner?
I cook it all.
All right. So remember I mentioned before that we have to prioritize certain things. So cooking every meal might be a little bit too strenuous, at least it might make you a little bit more too tired, it might be too much initially. So if we wanted to prioritize a meal for you to cook every day, I think breakfast would probably be the best choice, just because you're waking up, you have the most energy. So maybe we could plan that you would cook breakfast every day. And again, we're still using the same techniques that I mentioned before, so you're going to try to do as much sitting as possible. So an omelet, you might be cutting vegetables, where normally you might have stood on the counter and you're cutting that way. Maybe to preserve energy, you can bring the vegetables to your table and cut that way.
Kind of like meal prepping.
Yeah, you're going to meal prep, but you're going to want to do it sitting down.
Okay.
That way you're using less energy.
Got
So
it.
you're getting less tired.
Okay.
Right?
Mm-hmm.
All right, so after you eat breakfast, what's next on your day?
Then I take the dog out to use the bathroom before I go to work.
Okay.
Have an invisible fence though, so I really just walk outside and I don't really walk on it.
Okay, so another thing I want to emphasize with energy conservation is it's okay to ask other people to do other things. It's okay to rely on others. So your wife is home, so maybe your wife can stand outside with the dog. You mentioned that you have an invisible fence, so it's not really, your wife is healthy?
Yep.
Right.
Fit as a fiddle.
Okay, so it wouldn't be too big of a deal for your wife to stand outside with the dog.
I'd like you to come talk to her tomorrow.
Well, maybe she's in. She'll be here for the next session. I'll give you a handout and we'll talk all about that.
Okay.
Sounds good?
Yep.
All right. So after you walk the dog,
Then I go to work.
all right, so you mentioned that you work at your family's grocery store, right?
Correct.
Okay. So I think when you're at work, it's going to be super important to remember your precautions, remember the guidelines that we talked about.
Mhm.
And I know it might be a little tough to remember them all, so I'll make sure I give you a handout before, but I want to kind of work initially might be a little bit tough. So are you more of a manager? Are you on the floor? Are you more in an office?
I do it all, really.
So
Where-
maybe initially you could do more office work. That way you're not putting too much strain on your body.
Mhm.
So that would be kind of a better, I don't know if you do any ordering, but you could do things like that. I want you to avoid anything strenuous. We don't want to place strain on your heart any more than it is,
Okay.
right?
Yep.
And then again, as you go along, you'll be seeing the doctor, you'll be seeing other therapists once you're discharged, so they'll give you more guidelines. This is just initially some good ideas to follow. So now, we can move on to dressing if you want to.
Oh no.
You're
I'm
tired?
ready for my nap.
All right. So how about we do that tomorrow?
Okay.
And we're going to talk a little bit more about positioning, right? We talked about positioning,
Yep.
planning.
Prioritizing.
There you go. You're a champ already.
Mhm.
You're a pro at it. So tomorrow we're going to start applying those things to activities you might do throughout the day. So some things like dressing. Maybe if once we get through dressing, we could do grooming, that sort of thing, or any other. We'll talk about what you want to do.
You can
throughout
show
the
me
day.
how to get a nice beard like that.
Yeah, you might go through how to groom, shaving is another good one,
Great.
right?
Mhm.
Okay, so you're good. Any other questions before I leave?
Not that I can think of.
All right, so I'll see you tomorrow.
All right.
It's
Looking
been a
forward to
pleasure.
it. Thank you so much.
Thank you. And I'll bring you that handout tomorrow. Sounds good?
Yep.
All right,
Great.
perfect. Thank you.